Assalamualaikum doctors. In this video I am discussing about the sickle cell disease management. So first of all I am telling the sickle cell anemia. It is an autosomal recessive disorder, chromosome number 11. It is Afro-Caribbean ethnicity, so mostly African ethnicity. One of the Guthrie test. So we can ask that there is the screening during the birth time. Maybe the head is absent. They have not they migrated from other country. The general examination about small for age, multiple cannulation scars, pale or jaundice. So pale jaundice is the features. Local examination we find hepatomegaly more than 5 years of age and hepatosplenomegaly if less than 5 years or sickle thalassemia. Association, remember there are some complications. First of all, neuro, stroke, hemiplegia and cranial nerve affections, MSK, leg ulcer, avascular necrosis and SUFI, chest, acute chest syndrome, history about the severe chest pain and previous hospitalization, eye proliferative retinopathy, kidney acute papillary necrosis and priapism. Okay. What investigation we will do? Hemoglobin electrophoresis, diagnostic, hemoglobin F is 8 to 10%, hemoglobin S 90%, hemoglobin A2 2%, hemoglobin A1 0. Again, hemoglobin F is 8 to 10%, hemoglobin S 90%, hemoglobin A2 A1. A1 is 0 and A2 is 2%. Then full blood count we can find normocytic normochromic anemia with reticulocytosis. Blood film we find anisocytosis, poikilocytosis and sickle cells. Renal function test and liver function test and viral screening for hepatitis B virus, hepatitis C virus and HIV. Radiology, abdominal ultrasound, MRI, brain, hip X-ray, chest X-ray. Transcranial Doppler ultrasound after age of 2 years if shows if there are clots in blood vessels, if the flow is more than 200 ml per second. This is the indication for exchange transfusions and fundus examinations. So we understand hemoglobin electrophoresis, full blood count, blood film, anisocytosis, poikilocytosis and sickle cells. Renal function, liver function test, we know proliferative retinopathy and there is papillary necrosis. That's why kidney radiology we are doing and fundus examinations. What are the types of sickle cell crisis? Okay. Number 1, splenic sequestration crisis needs life-saving blood transfusions. Number 2, vaso-occlusive crisis. It is acute painful crisis. How it is? It is an abdominal pain, bone pain, dactylitis which triggered by cold exposure, infection and dehydrations. Treatment is admission, warming the patient, good hydration, oxygen, analgesia and antibiotics. So treatment admissions, warming the patient, good hydrations, oxygen, analgesia and antibiotics. Functional asplenia at the age of 1 year increase the risk of overwhelming infection by capsulated organisms. Treatment is full immunizations, extra vaccine, prophylactic penicillin for life. Acute chest syndrome can be, that is severe chest pain, fever, cough. Treatment is admission in the ICU, oxygen, painkiller, warmth, hydration, IV antibiotics, macrolides and ceftriaxone and physiotherapy. Stroke can be present. It is present with hemiplegia with cranial nerve affection. Treatment is urgent transfusions. Other are priapism and avascular necrosis and aplastic crisis. What is the treatment we offer for sickle cell disease? Number 1, folic acid to prevent as a side effect called macrocytosis, which is an enlarging of the red blood cells. Hydroxyurea, remember hydroxyurea aim to increase the hemoglobin F more than 30%. Myelosuppressive agent is the only effective drug proven to reduce the frequency of painful episodes starting from 9 months to 2 years. Okay. So indication hydroxyurea when we give frequent painful episodes 6 or more per year, history of acute chest syndrome, history of other severe vaso-occlusive events, severe symptomatic anemia, severe unremitting chronic pain that cannot be controlled with conservative measures. Side effects of hydroxyurea is number 1, acute stomach pain, constipation and diarrhea. And long-term and painful skin ulcers, aphthous ulcers, non-ulcerative toxicity with erythema and skin infiltration, pancytopenia, so regular CBC is recommended. Treatment of autosplenectomy, functional at the age of 1 year and anatomically at age of 5 years. Advice for splenectomy. Management of crisis is number 1, exchange transfusion indications, that is priapism, acute chest syndrome and stroke. Blood transfusion indication is sequestration crisis and aplastic crisis. Genetic counseling and bone marrow transplantation is the definitive treatment. And we give some advice like avoid cold weather, splenectomy, keep warm, good hydration, avoid overcrowded areas, avoid high altitude, check the tummy if less than 5 years for sequestration crisis. Avoid contact with patient with parvovirus because it triggers the sickle cell crisis. I'll teach them how to check the spleen, okay. And the child should take the pneumococcal meningococcal influenza vaccine. So treatment, just headline I am telling, folic acid we are giving, hydroxyurea we giving, folic acid, hydroxyurea. And if crisis, then exchange transfusion indication, blood transfusion indications, genetic counseling and bone marrow transplantation is the main definitive treatment and advice we give. What is the causes of splenomegaly in sickle cell anemia? If age less than 5 years, sequestration crisis, sickle thalassemia and portal hypertension. Okay. Causes of abdominal pain in sickle cell anemia is occlusive crisis, gallstone, sequestration crisis, lower lobe pneumonia, liver affection and NSAID. Long-term complications are delayed growth and puberty, leg ulcers, retinopathy up to blindness, cardiomyopathy up to heart failure, cholelithiasis, renal impairment due to papillary necrosis and stroke. Multidisciplinary team we involve in sickle cell disease is hematologist, neurologist if stroke, ophthalmologist, orthopedic and hematologist, and liaise to the school and genetics. So this is sickle cell disease management. Thank you.